Hit Exchange Media Coverage, HIMSS 11.
I think the whole world is trying to address how do we transform healthcare? How do we make it more cost effective? How do we improve safety? How do we improve quality? So I think when I look around the landscape here at HIMSS and beyond that as I travel around the globe, I think about the technology component of that, but it's not just a technology component. How do we transform the delivery system and meet the objectives we all have through the technology, through work process redesign, and certainly through, as we adopt EMRs, EHRs, you know, whatever the buzzword is in each of the geographies, how do we take that data that today is either sitting in silos, being created as a result of EMR adoption? So how do we connect all of those silos? Key part of IBM's message, because we certainly want to share data in order to change healthcare and to improve healthcare. So, but once we have that data created, how do we use it? How do we use it for research? How do we do the analytics to drive back to the goals that we have?
That's great perspective. Talk about, with your more of a global perspective, involvement really on an international basis, where does the U.S. fit in, or how are we in the kind of the growth curve of adopting technology and collaborating on some of these new technologies?
You know, I would say we're literally all over the map, literally and figuratively. When it comes to EMR adoption, we're not high on that compared to a lot of countries like Australia, the UK, and Canada that have high EMR adoptions in certain segments of the healthcare ecosystem. When it comes to thinking about data sharing, we're probably ahead of other parts of the world because of the activities that have gone on in the Office of National Coordinator, ONC, starting with Dr. Brailer in 2004, you know, Dr. Kolodner, and now Dr. Blumenthal, and whomever succeeds Dr. Blumenthal. So we've made a lot of progress in thinking about how do we design, how do we build the infrastructure, let's make sure we have the data to share. So we're at different points, I think, of the journey. When I think about analytics, you know, we certainly at IBM spend a lot of time thinking about analytics. How do we make better, smarter healthcare decisions based upon the data? So it depends upon which part of the healthcare ecosystem we're talking about and how you compare the U.S. To the rest of the world.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.